Hello everybody and welcome to another year of IAHSS 2020. My name is Dan Salashore and on behalf of the team here at 911Cellular, we're extremely excited and thankful to be a part of this event for the fourth time now, this year as a bronze sponsor. So thank you to all those who are in attendance and to all those who helped make this happen. Although this year is obviously a little bit different, we are just as, if not more, excited. Today I want to spend a couple of minutes focusing on our brand new COVID Toolkit. Our COVID Toolkit is a series of technologies that we've created to assist your facilities in reopening safely. As part of our commitment to healthcare and as part of our commitment to IAHSS, we are making these technologies available completely free of charge with no obligation for all members of IAHSS and or attendees here at this year's virtual convention. So there is no charge for what I want to show you here today, and without further ado, let's take a few minutes and tuck right in. Bit of brief background. For those of you who are not familiar with 911Cellular, we are a company that's been specializing in modernizing panic button technologies for healthcare. So we have a whole slew of panic button technologies. We have custom deployment plans. We can link them together with a mass notification system, integrate into your existing systems. A lot of things that we can do and have done very successfully. We have over 400,000 panic buttons in the field right now. And we really have become location experts. So all of our panic buttons can notify security forces of the location of activation down to the floor and even the room number, even if it's from a mobile device like a workstation on wheels. So panic buttons and mass notification technologies have really been a huge focus of ours for a long time now. But this year is obviously very different. A lot of things have changed, and we felt the need to do our part in assisting your frontline workers and ensuring the safest possible work environment, which is why we've created the COVID Toolkit. So without further ado, let's jump into the toolkit itself. Again, this is being made free of charge, no obligations for all IAHSS members. The first feature that I want to talk about here today is the digital self-assessment. So we feel like self-assessments are a great way to enable those who are either symptomatic or of known exposure to really get the help they need before they show up to your environment. The challenge that we saw in the field is that current self-assessments either lack customization or don't make the best use of the data after the fact once it's been collected. And that's really what we've seen with self-assessments like those from the CDC, which are fantastic, but which are very high level because they have to be. As well, it's similar to what we've seen in organizations who are using Google Forms right now, where it's very difficult to aggregate that data to spot trend lines and to make good, solid use of the back end. So we've gone ahead and we've created a self-assessment technology that is completely customizable. It's both available mobily and it's available on the web as well. With our self-assessment technology, the first step is to assess. So the first step is to create these tools, create the questionnaires. And we've built a role-based model here for self-assessments, meaning you can customize the questions based on the roles of the individuals and community members that you have and that you want to ensure are not symptomatic and or have known exposure prior to coming to work. So step one is to create your self-assessments. All of that can be done directly in a cloud-based web portal, which is what you're seeing right here on my screen. So you have total control over the self-assessments, you have total control over the questions, you have total control over the roles, as well as the privacy permissions associated with those assessments. Again, this is where that customization and the control over your environment is really different and very important. So once you've created your self-assessments, the second step is to allow individuals to take those assessments. So again, this is a mobile or web-based solution, and simply via the app or via the web, members of your community can take the self-assessment. So I have a badge that's expired. I'll take a new assessment. First thing I do is I select my role. Now I'm going to go ahead and I'm going to answer the questions. If I answer the questions in a way that are acceptable, I will be issued an access badge. This badge is being used for access control purposes at many healthcare facilities we work with nationally. You can think about it as a mobile boarding pass type of situation here. You'll notice that the role of the individual, as well as the name and an expiration, are all very visible to the badge holder. Now, if I take this self-assessment and I answer in a way that indicates I may be exposed or I am symptomatic, I am not issued this badge. I am issued a customized statement, which is customized by you and your team, informing me of the next steps that I should take to ensure both my safety and the safety of the entire community. If somebody does answer in a way that indicates that they may have exposure or may have symptoms, you and your team can configure customized alerts. So these alerts can go directly to HR, they can go directly to security, they can go to anybody you want, and you can be notified of the exact situation so that you can follow up, right? This is not to shame people, this is to give people the assistance that they need based on the questions that they answered. So a key component is, not only being able to take these self-assessments, but also being able to act on some of the data, specifically some of the unsatisfactory answers and the data from those individuals. So this is an example of that customized screen that I was just mentioning. If somebody were to answer the self-assessment in a way that indicates exposure and or symptoms, all of the text that you're seeing here is customizable by you and your team. As well, the lockout period is customizable as well. So you can set exactly how long it should take before the person can take another self-assessment. One quick note about privacy, again here, just to reiterate, you control all of the information. You control if it's shared at all, and if it's shared, who's it shared to. There's just a tremendous amount of customization over the roles and the privacy associated with every role, because we know every organization, and in fact within specific organizations, different groups are going to need to have different privacy settings. So that's why we've built this customizable system the way we have. The last component of the self-assessment is really the ability to analyze. So all the data from these self-assessments is visible in the exact same web portal for your review anytime you want. You can spot trend lines. You can see, for example, by date, the results of the self-assessments, both positive and negative. You can search by role. You can see the results of the self-assessment. You can also see a list view. So this is very, very important to us because we want to provide you a data point to assist in making determinations about phase 2, phase 3 reopenings, right? So we understand this is one data point and just one, but we think it's a very important thing to know and to factor into your conversations about what are some of the next steps you should take to safely reopen during this pandemic. So in addition to the self-assessment, we have a contactless Bluetooth thermometer. So this is a smart thermometer. An access control badge can be issued from this as well, and it can be paired with the self-assessment. And what that means is you can create a situation where your employees need to have taken a self-assessment and had a temperature reading within an acceptable range before they're issued that access control badge. Okay, so this is really a two-factor verification to do the best thing we possibly can to try and ensure that individuals who are entering your facilities are doing so safely. The last component I want to talk about, because I want to be conscious of time, is the ability to have local COVID-19 resources directly in the mobile application. So instead of just directing people to the CDC site, things are changing all the time and things are changing locally. So right here in the mobile app, you can totally control all of your customizable COVID-19 resources, including where local testing centers are, your latest positive case data, anything you want. You can very easily add and make visible right here to all of your staff members so that they have the cutting edge information they need to make the best decisions possible. This has been just a brief 10-minute session about the COVID-19 Technology Toolkit. Again, this is being made available completely free for IAHSS members. If you have any questions about it, any comments, please feel free to reach out to any 911 Cellular sales rep. Also, please do consider us for your panic button solutions. I want to thank you for your time. Thank you for watching this video and wishing you a great convention.